Hey everyone, this is Tracer coming to you from tracerize.com, your home health business expert from Open to Growth. And I wanted to come to you today and provide you with a quick list of different types of referral sources where you can go out into your community and hopefully find some new business to help grow your agencies. So bear with me as I go through a quick list. Some of them are probably very standard and you may already have existing relationships, but it never hurts to expand that network. And then others may be ones that you have, obviously you have in your community, but you maybe haven't spoken with before. So I'm not going to spend a lot of time going into in depth into each one for this video, but I will make individual videos about how to best approach these types of referral sources to build a partnership with them and to grow your professional network. All right, so let me start it off. I'll go through the list fairly quickly. And if you have any comments, please add them into the comment section. If you want a specific video on maybe one of these um, different types of referral sources that even one that I haven't covered, please leave it in the comment section. Also, don't forget to like and subscribe and turn on the notifications icon. So first up, assisted living facilities, great referral sources. Independent living, that was actually my favorite when I ran an agency. I had some really good relationships with people there in a very prominent community in the Palm Beach area, and it was pretty awesome to do. Nursing homes, as you all know, the short-term rehab beds for Medicare are very good referral sources as they're going to be discharging home from that nursing home stay and probably need some additional help. Medicare certified home health. If they go home from the facility with Medicare certified home health, you can certainly be in there as a non-medical agency or a private pay agency to where you become the eyes and ears of the skilled Medicare agency to make sure that you guys both, between the two of you, provide the skilled care and then provide the ADL assistance, the activities of daily living that you and the non-medical industry would provide. But that way, the goal is there to keep the patient on the Medicare episode and getting the skilled care that they need. And then at the same time, being the eyes and ears for the Medicare agency, since your non-medical agency will be spending probably more hours throughout the day there. And you can help communicate back and forth to keep that continuity of care going. Moving on, you may even see one in the background here. There's a church behind me. This is, picture, by the way, is from downtown Orlando. But church bulletins are always a great way. Hospices, identify some hospices within your area. They are already working with some of the same patients that you might have at some point. But the real key to this is that if they also run low on staff. So if they are running low on staff and you may have some staff that need some additional work, you can partner up with them and potentially provide through a staffing agreement different employees for them to come in and help them out so that everybody's getting the same care that they need. Hospitals and emergency rooms. Hospitals, they may or may not discharge directly home. Some people do. It depends on what they had done, why they were admitted to the hospital. Emergency rooms are good in the event that people don't admit to the hospital, but the discharge planner knows that they might be going home to an unsafe environment, especially if they're living alone. Geriatric care managers are good, trust officers, wealth managers, elder law attorneys, guardians, VA hospitals, geriatrician physicians, adult daycare facilities, plastic surgeons, day surgery suites, employee assistance programs are good, workers' comp programs are good. Usually you probably get into contract for those. Home and community-based services are really good. Those are your Medicaid managed care or Medicaid waiver programs. Commercial insurance can be good to get into contract with. Long-term care insurance agents are actually really good people to know because they need a network of people as well, a non-medical agency. And I will tell you, I did a presentation one time with them and they didn't understand that there were the Medicare Part A benefits for the hospital side and hospital, home health, and hospice side that are covered under Part A. They didn't understand that that skilled short-term intermittent care benefit was available at no cost to their members. So yes, they might write long-term care insurance policies, which is where you come in the non-medical agency, but they weren't aware that the Medicare benefit for Part A existed. So that's something to get into with them that can keep some really good action going with long-term care agents. Fire departments are good, and then supplemental staffing agreements are good for the Medicare certified agencies and the hospitals, potentially, and then also your nursing homes. Those are always something to consider because there are ways that you can help provide staff when they may not have enough because they're probably going through a staffing shortage just like you. And then you get into an agreement with them, and then you put your people to work when they're not working on your existing cases. So I hope that that helped. A quick list, more to come. Stay tuned for individual videos for each type of referral source. And I wish you a great week ahead, and hopefully come back and find this information valuable. Let me know in the comments if you have any specific requests. All right. Thank you. Bye-bye.